So sometime during the day 2 through day 14 mark is when you're supposed to start taking your bariatric vitamins. So if you haven't already started taking those, now is your reminder to go ahead and start. And I just want to kind of go through the vitamins that we have here in our store with you, just to make sure that you know what you should be taking. Okay, so if you had the sleeve, your bottle's gonna look something like this. This is the one that does not have iron. Most of you probably have the one with iron. So unless you have some sort of a condition that requires you not to take additional iron, you should be on this one with iron, and that's a 1 per day capsule. So you want to take 1 of the capsules per day, and then you also want to be taking 2 of the calcium. They're 500 milligrams a piece. That comes out to 1,000 milligrams a day of the calcium citrate, and that should cover you for the sleeve. Now, you do want to remember, if you're taking any kind of thyroid medication, take all of your vitamins separate by at least 4 hours if you can. And then also you have to separate the multivitamin and the calcium. So my recommendation to you, maybe if you're not on thyroid medicine, take your multivitamin first thing in the morning with your breakfast, and then take 1 calcium at lunch and then 1 in the evening with your dinner. If you are on the chewable for the sleeve, we have 2 flavors. It's the orange or the strawberry. You may also have gotten the mixed berry, and that's okay. You are going to take 4 of these per day, and that is it. You don't need any additional calcium or iron or anything like that. So 4 per day on these. I would take 2 at a time. So you could take 2 with breakfast, 2 with dinner, or you could split it up throughout the day. Ultimately, that's up to you. But that's what you should be doing if you're on these. Now, if you have the switch, things are a little bit different. You know that you have to take a little bit more. And so if you are doing the capsules for the switch, you most likely have this bottle. This is the Bariatric Advantage Ultra Multi with iron, and you do take 3 of these per day. With that, you also want to be taking 1,500 milligrams of the calcium citrate, which comes out to 3 of the little chews. Because the multivitamin capsule does have iron in it, you have to take them separately from your calcium. And then you should be taking a daily B complex. We sell the B50 complex, that's what we recommend. And so my recommended regimen for you is going to be to take 2 of your multivitamin and the B complex in the morning. And then you can maybe take 2 of the calcium at lunch, 1 at dinner, or vice versa. That way you can get that all in. You may also, if you had surgery very recently, we did get in a new version of the bariatric switch vitamins. And so this is just a 1 per day capsule. It's a little bit lacking on your vitamin K, but most of our patients are going to be just fine with that. So just got to make sure you get your labs checked at the 6-month mark and you'll be fine. But with this, it's a 1 per day capsule. And then you still do need the 3 a day on the calcium, the 1,500 milligrams, and the little yellow B complex pill. And so again, take the B complex in the morning. If you take it in the evening, this is something that converts your food into energy. And so if you take it in the evening, you may notice that you have a hard time sleeping because it does tend to give you an energy burst. So take it in the morning or take it at lunch, just don't take it right before bed. And then if you had the switch, but you are on our chewable regimen, it is this one only. That's the only one that we have for the switch that's chewable. And so you take 4 of these per day. You also need to take 500 milligrams of the calcium citrate. So just 1 of those calcium chews a day. And then as well, the B complex. And so just 1 a day on that too. Now, with any of our surgeries, but particularly with the switch, we do recommend that you have a probiotic. And so if you're taking a probiotic, it either looks like this or like this if you got it from us. And so the probiotics can be really helpful if you're having any kind of GI intolerance to foods that you're doing or drinks that you're doing at this point. If you're having diarrhea, constipation, if you're having bloating or gas, a probiotic can definitely help. So if you're not already doing those and you're having that issue, add 1 of these in. This one is a pre and probiotic, and then this one is just a probiotic. The pre and probiotic is nice to start with because it has the extra fiber that the good bacteria feed off of. And so this is probably where I would start if you haven't already, but this one works as well too. All right. So again, just kind of check in on your hydration, check in on your protein, make sure that you're getting up and you're walking around and staying active throughout the day. If you're not staying hydrated, you're probably feeling nauseated, and that's a really vicious cycle that you have to get out of. So try using some of the electrolyte drinks like a Gatorade Zero, Powerade Zero, Propel, to see if that can kind of help you move past the dehydration, and then really just be mindful of, drinking all throughout the day and getting that in.